You're watching CTOM TV. Knowledge is power.
I know there's some general information that you'd like everybody to know about HPV.
I think it's very important. And in preparing for this, I had to go back and go over my immunotherapy and virology.
Oh,
But I haven't looked
that's why
at it in
you're
a
looking
while.
a little humble. Okay,
Yes,
it's not
yes.
common. This is good. Okay, good.
I don't normally have to research things like this, but in this case, I did have to, and it's important to get updated information. Things change a lot.
Yes.
And it's important for me to understand where my gaps are in my knowledge too.
Okay, which you've now filled in, and you're going to fill in for us.
Hopefully.
Okay, so where do we begin? What would you like us to know?
What do you know about HPV?
Me?
Yes.
Okay, I know very little. Human papillomavirus
Right.
is what HPV
Right,
is,
yes.
or that's the long form of the
Yes.
acronym. It's a virus, I know that much. And I do believe it is sexually transmitted, and that there's many different strains, and that it can lead to warts on all different parts of the body, potentially as one kind of symptom or side effect.
Plantar warts, yeah.
And also, ultimately, as we've discovered, cause cancer.
Mhm.
That's about the extent of it.
Mm-hmm. Great.
My
Well, I
knowledge.
think that's great. So HPV, as you mentioned, human papillomavirus, is actually many different viruses. It's obviously it's going to be one species,
Mhm.
but there's we recognize now well over 200 different strains.
Mm.
So there's a
Wow.
lot of different strains.
There's been a
going
lot of
on.
mutation there.
A lot of mutations, yeah.
Okay.
Yeah. So it affects, so the way scientists determine whether it's present, they used to do a stain.
Okay.
And the staining was a stain that, they would stain positive for certain of the viral elements.
Mm-hmm.
Now what we do is we look for HPV DNA.
Okay.
So we know the
We know
sequences.
we can now.
We can, and that's the
Technology has
easiest
improved.
way. Yeah.
Okay.
Digital PCR
All right.
is a great way for that.
Now, what percentage of the human population would have that?
Well, we'll get to that in a
Okay.
second.
All right. We'll get there. All right.
So well over 200 different strains.
Got it.
So in looking at different cancers, and there's a bunch of different studies done, but what they did was they looked for this viral DNA, this HPV DNA, and they found it in over 90% of cervical cancers, probably 95% of cervical cancers. I think it was in 91% of anal cancers, 75% of vaginal cancers, oropharyngeal, which is basically the throat region. It's found in over 70% of those. Vulvar, about 70% of vulvar tumors, 65% of penile cancers, at least 32 to 35% of oral cancers, and about 20% of laryngeal, which is the vocal cord area, about 20% of those cancers. So basically what it is it's a type of virus that's basically just made of 8 genes. 8 simple genes broken down into 6 genes that are called early genes, and they're designated E. And then we have 2 late genes.
Okay.
And it's a circular double-stranded DNA, so it's the same sort of conformation as human DNA.
Okay.
The early genes are involved in replication and lytic life cycle and so on in the processes of infection. And then the late genes that are expressed late. So the early genes are expressed early, the late genes are expressed late. They form the viral capsid particles and the structural components.
Okay.
So once again, there's well over 200 documented subtypes. Out of that, we have about 15 or 16 of them that are cancerous, that can actually cause cancer. So we call them oncogenic strains.
Okay.
The 2 main strains are based, so they're all designated with a number based on when they're discovered. And so the 2 main strains that have had most of the research are strains 16 and 18. And they're involved in about 70% of the cervical cancers.
Okay.
So we also know that, and I wrote some of the strains down that we know of now: 31, 33, 35, 39, 45, 51, 52, 56, 58, 59, 68, 73, and 82 have all been confirmed as oncogenic.
Okay.
Now, they're not all the same. They don't all create that susceptibility.
Okay. 16 and 18 are the most.
16 and 18 are the most tested ones,
Okay,
and
most
the
tested.
common ones that we know the most about,
Okay.
and that are usually the subject of the test.
So there's still lots to learn.
There's still lots to
Okay.
learn, and there's still lots that we don't really look at.
Okay.
So, I know one of the questions was involving should men get it. Well, a recent study looking at the DNA, not the staining, has been shown to HPV strains occur in most people. Very few people don't have HPV of some sort. Doesn't mean they have the 16 or so oncogenic ones.
Right.
They may just have plantar's warts or some sort of warts or some innocuous form of it.
Okay.
But in general, HPV DNA, regardless of whether it's oncogenic or not, has been found in over 65% of males.
Okay.
And in 25% of those males, or 26%, they had multiple strains of HPV, so not just one or two types. And it's in general found in over 80% of the population.
Okay. Okay. 80%.
80% of the population. I would say it's a lot higher.
Okay.
I would say it's probably close to the high 90s.
Were you trying to get at just a moment ago that the old diagnostic approach of staining is not going to give you this detailed information?
No.
Okay.
It has to be DNA tested.
Okay. Has to be DNA tested. Okay. Is there a specific type of DNA?
No, I shouldn't say that because, while we're talking, there's probably, some other more specialized stains out there right now. I didn't look into that, to be honest, because my thing is DNA, and I focus on DNA as an analysis tool. So, we'll leave the staining up to the pathologists.
Oh, okay. But almost certainly the standard staining won't cover the information that somebody would want.
Right.
Okay, got it.
So I think this opens up an important topic. You hear a lot of the time, you see these guidelines for HPV testing, and most definitely HPV vaccines are really important. They have one now, I believe, that looks at 9 different strains or targets 9 different strains. I mean, obviously, that's not going to cover every strain, but it's going to cover the most common ones. And obviously, it only covers the oncogenic ones, the ones that cause cancer.
Right. So you said there are 15 or 16 of those.
Yeah, at least 16 different oncogenic subtypes.
So the current vaccine isn't covering all those.
No,
okay.
And all of these strains have a different, they don't all affect. So they have a different what we call penetrance. And so they don't necessarily affect everyone the same way. So, one strain may give you a much higher rate of cancer than one of the other strains. Or this high risk and low risk strains.
So it's early days is what you're saying in terms of the research into this.
I think it's always going to be early days when it comes to infectious agents.
Yeah, okay.
There's just too many of them, and they're constantly changing.
Okay.
And, throwing different things at us. So the big question here that I think is important is an indication for treatment.
Okay.
So the general consensus that you hear a lot, and I think this is just terrible information, is they say, well, if you're within a certain age group, then, there's no point getting it. Or if you've had a previous infection with an HPV, strain. But once again, there's over 200 different strains.
Right.
So just because you've been vaccinated against one strain does not mean you're going to be vaccinated against the other strains. So even if you've got 5 different strains in your body, it's still of value to get one of these vaccines. It won't protect you against the strains you already have because you've already developed antibodies for those, but it will continue to provide you protection against the other strains. And as you become more infected with different strains of HPV or other viruses, you open yourself up to sensitivity of reinfection with different subtypes and different strains. And that's not just with HPV, that's with many different strains.
Right.
So having HIV, for example, or hepatitis or even herpes can definitely increase your sensitivity to getting infection with HPV strains. It's just a matter of exposure.
So at any age, there's value to having this vaccine. Not
everyone
just
should get.
because
Everyone should get these vaccines.
Initially, I know years ago when it came out, there was this, it's just for teenage girls who have not yet been sexually active. And then,
And I'll get into that
okay.
right now, because I think that's an important part of the equation that has led to this misleading information that only certain people should have it.
All right, let's talk about
And
that.
those studies were focused on cervical cancer. These guidelines are based on cervical cancer. They're not based on all of the different cancers that HPVs
like you
cause.
mentioned the throat and the larynx.
Exactly.
And,
so
okay.
these HPV vaccines will radically change how many people get these cancers. And
not just the cervical.
Deadly cancers, not just cervical. So most of the data has been in cervical and on strains 16 and 18. And I think that is the problem with the guidelines right now.
They're outdated.
They're totally outdated.
Okay.
And the people obviously who are doing this are not virologists, or they don't have enough knowledge on the HPV or the oncogenic functions of HPV. And so I think that's really important. I think every man, woman, and children should get whatever vaccines are available, and should get the 9-valent vaccines if possible.
Okay.
It's going to radically change how many people get cancer.
All right. So regardless of your age or gender.
Yes. And so the age issue is kind of important because HPV only affects certain cells in the body. So it's not going to affect every cell in the body. Sure, you may see a plantar's wart on your hand and so on. And there are two different areas that they target. But specifically the ones that we're interested in right now, the oncogenic variants, they typically only target something called the parabasal or the basal cell. And this is a region of cells, mostly undifferentiated cells, under the epidermis of the skin. So the epidermis is the upper layer, and these are kind of in the basement membrane area. And this is, as you know, you've probably heard the term before, stem cell niche. So this is a stem cell niche area of the skin.
Okay.
And so in the cervix of young women, when they're just starting puberty, what happens is that basement area, or that basal cell area, can lose the upper epithelial layer, and therefore there's access of these HPV viruses to that layer now. So they have increased access to that layer, and that happens to women.
Sensitive.
Yeah, so it happens in an area called the transformational zone, and that's where a lot of these basal stem cells are located.
Okay.
So it's a mechanical thing. During puberty, there's more access to this transformational zone for the HPV. It's easier for it to infect these cells during puberty. Also happens during pregnancy, and it also happens during contraceptive use too. So it kind of opens up this area to infection.
Wow, no doubt. During those very key reproductive times.
Yeah. And so this is where, and also there's another process that involves the movement of the stem cells during puberty in young women, where they move from a protected area down to the cervix. So all of a sudden you get this double whammy of a movement of stem cells to a different area during puberty, and also access. They're not as well protected. So the HPV infection that could be dormant has a much better chance of infecting these stem cells. And once again, it only affects these stem cells. So that's the important thing to note. Now, also abrasions. So, you can, we do see this in women that have sex at an early age, prior to puberty.
Prior to puberty?
Yeah.
So are we talking, we're talking about people who are sexually
assaulted.
assaulted?
Yeah. They have a much higher increased risk for HPV infection.
Oh.
What can happen is the abrasion removes that top layer of epithelial cells and leaves that those basal cells exposed. So once again, they have HPV can have access to them. Yeah.
That's sad.
But that is a common mechanism, So that's also a mechanism in other areas of the body,
Mm.
is this increased access to this basal area of undifferentiated stem cells.
Mhm. Which happens for young women at some very pivotal moments.
In their cervix, but it can also
Mhm.
happen in other areas of the body.
Got it. Okay. Okay. Wow. Okay. So hence we come back to, yes, of course, get the vaccine,
Everyone,
because
yes.
there's so many factors that can influence whether you're going to be infected with any one of these
many strains, and we don't know all of the oncogenic strains.
Mm.
You know,
Yes. No. As you say, there's still
we know
lots to be
16 right
discovered.
now.
Of 200 potential.
Right.
Mm-hmm.
So, so probably another question is I don't know. Do you have this question? Or
Oh
should
yeah,
we answer some
I'd be happy to ask
questions right
you
now?
some questions now. I've been trying to hold off.
Okay.
Okay. So I'll just start at the top of my list here.
Mm-hmm.
Okay, so first question that came in was, if I've had warts on my hands and feet as a child, does that mean that I have HPV already?
Yes.
Okay. All right.
Does not mean you have the oncogenic strains of HPV.
Right. Which Alex is saying means still get the vaccine.
Yes.
Still get the vaccine because
it won't protect you against the warts because it's not designed for those strains.
Mm-hmm. But you may not yet have
Mm-hmm.
those cancer-causing ones, or all of them.
Right.
Mm-hmm. Okay. So then another question is, how do I know if I have HPV?
You get tested.
Okay.
You get the DNA test.
DNA.
Yeah.
Okay. And can my GP do this for me?
Yes.
Okay. So
will they do it? What strains will they test for? You know, that's the thing. Is you want to be tested for all of the strains. Most tests, most commercially available tests, and as we know, the medical system is not going to test for strains that are not common in this area. So, for example, some of the oncogenic forms are much more common in India than they are in Pakistan or Canada or US. So they're typically only going to test for the 16 and 18 here in Canada.
Okay, all right. But now, is it Gardasil? Is that the right name for the vaccine?
The vaccine, yeah.
Okay. Are there
there's
others?
Two of them. Yeah,
there's
two of them. Yeah.
Okay. So a different company is making another.
And they increase the amount of strains that they cover all the time.
Right.
So right now the popular one is the 9-valent.
Right. Okay, as you were saying. Okay. So another question. Does a Pap test look at HPV?
No. It looks at signs of transition, looks at dysplasia, but it's not a designated test for that. In fact, it was designed before we had knowledge of this.
Okay.
So
maybe if you had a Pap test and your doctor saw something's a little off, they might then
definitely
follow
get
up
a Pap test. Yes, it's not going to tell you. You want to know what strain it is and so on.
Right. So you'd move on from there.
Yeah.
Now, are there specific names of tests for HPV that you would recommend, or again, as you're saying, each region might be looking at different things, so that might be hard to answer.
Exactly. Yeah.
Okay.
You have to ask those questions, and your doctor should tell you those questions.
Okay.
If your doctor tells you you're getting an HPV test, your doctor needs to tell you which strains they're testing for and which strains they're not testing for.
Okay, so that you can know whether you're
and
covered.
you need to ask those questions, and if your doctor can't answer them,
tell
him to answer them. Tell him to find out.
Okay, find out which strains this test.
They shouldn't be ordering tests that are going to be misleading.
Okay, right. Meaning, we don't want people to come away thinking they were tested for all the important strains.
And we see that a lot.
Right, that is true. We do.
Yeah.
Mm-hmm. Okay. All right. A few more questions.
Mm-hmm.
All right. First question here: can you get HPV from kissing?
Yes.
Okay. Is there some specific mechanism that makes that happen, or is it simply if somebody that you're kissing has it, off we go?
Well, you get exposure to the virus, and then if you have, once again, the mechanism is very important to understand.
Mm-hmm.
If you have, for example, increased access to the parabasal and basal cells, which occur in lymphoid tissue and so on,
Right.
then obviously you're going to have a higher chance of that infecting you and causing causing cancer.
Right. So there's so many factors that
It's
could
very
be
complicated.
happening or not happening at any time.
Exactly.
Wow.
So why not just be safe?
Right.
Have the
Just get
antibodies ready to go.
Yes, and that is why I've heard you recommend for young folks pre sexual activity, male or female.
Everyone. 90-year-old grandmothers.
Right, because again, you don't know whether you already have the cancerous strain
or what strains you've been infected with.
Right.
And as we said earlier, 25.7% of men have multiple strains.
Right.
So that's an important consideration, and that's why everyone needs to get this.
Okay, and that is, I guess, the fundamental point you're coming to in your talk today is that get the HPV vaccine.
Prevention.
So why would I bother going to the doctor and getting tested then? Why wouldn't I just go to the pharmacy?
Just go get the pharmacy, yes.
All right. Okay.
That's what I did. Yeah.
Okay. So on that note,
you may have to pay for it yourself.
That's right.
But pay for it. It's about $150. It's well worth it.
Okay. So on that note,
yes.
You may, have to pay out of pocket for this vaccine, but there's nothing barring you from getting it if you want it, minus the $150. And is that something you just go to your pharmacist and ask for, or do you need a note from your doctor or some such thing?
You may have to cry and argue because they'll give you all of this misinformation and tell you that
you don't need it.
You don't need it, or if you've been infected, or it's not approved for your age group, or something. You tell them the information you got from us.
Right. And again, if you're willing to pay out of your pocket for it, then there really shouldn't be.
There shouldn't be, yeah. And usually, in my case, they say, "Oh, why would you want it?" I said, "I don't care. Just give it to me." Well, then you're gonna have to pay out of pocket. Okay, not a problem. $150 for a lifetime of protection, or we don't know if it's a lifetime, but hopefully.
Yeah, it's certainly worth saving your pennies if your budget's tight for that, and if not, well worth it. Okay, so a few more general questions.
I see a good question on the screen over there that I was just about to break into.
Well, let's see here. Okay, well, let me ask you this question on the screen there.
Okay.
How can a virus like HPV cause cancer?
Excellent question. So, as we mentioned, we've explained part of the mechanism. It's access to these stem cells that the virus preferentially infects. So I'm not sure if you recall, but we discussed the different genes that it has. HPV has 8 genes.
Looking at my notes here. Yes, 6 early genes and 2 late genes.
Right. So early gene 7 binds to a tumor suppressor gene called the RB. Retinoblastoma gene. It is a tumor suppressor, so it plays an important role in inhibiting the cell cycle and many different functions. I won't get into it, but this E7 protein from the virus, the early 7, inhibits this genetic signaling pathway called RB, and then the E6 protein inhibits a different tumor suppressor gene called the P53. And the P53, as we all know, is called the guardian of the genome. It protects the genome from cancers. And so both of these genes are commonly inactivated in cancer.
What was the first one with the E7?
RB.
RB.
Retinoblastoma.
Okay, so RB and P53 are helpful in that they suppress the growth of tumors in the body.
The tumor suppressor genes.
Okay.
Yes.
And unfortunately, the E6 and E7 genes that are involved in HPV shut this process down.
Right.
Okay, got it.
So now this opens up another important point. A lot of our patients, when we do inherited genetic testing, we see that they have a germline or inherited mutation in either RB or P53. So if these patients already have a genetic mutation and then they get exposure to even a weaker strain, or even if their immune system is fighting it off, they're going to have an increased susceptibility to oncogenic transformation from HPV.
Sure, the development of cancer.
Now, we do see these 2 genes, E7 and E6, in normal tissues that are not cancerous. So just their presence there alone does not cause cancer.
Okay.
It can, There's a multitude of factors, but obviously in patients who do have HPV associated cancer, they probably have
The
mutations
p53 mutation.
in these genes previously. They could have co-infection with other variants, other different viruses. They could have a suppressed immune system. There could be a variety of different factors going on here. So it's not just these two genes, but that is the mechanism of how they work. They downregulate these important integral tumor suppressors. So very important.
Yeah, so they stop your body from doing what it could do to prevent cancer.
Right.
Got it.
Right.
Hence, if you can have a vaccination,
you're that much further ahead of the game.
Right. Yeah. Yeah.
So the HPV infection causes a very unique form of cancer. I won't get into the different cell types and so on. Typically, it's associated with a squamous cell subtype versus an adenocarcinoma.
Okay.
But when HPV causes head and neck cancers, these cancers usually have a much better survival rate than HPV negative head and neck cancers.
Okay, you're waiting for me to ask you why. I can't wait to find out.
Yes. So one of the things is when you get infection with an HPV agent, you have a lot of what we call tumor-associated antigens. And an antigen is what we call an antibody generator. That's the term, antigen, antibody generator.
So this is good.
Yes, so that's antibodies are the protectants of our immune system.
Okay.
They target foreign invaders and tumors and so on. So when HPV infects and causes cancer, you have a high level of these antigens, and this tweaks the interest of the immune cell system. And more importantly, the location of HPV infected cancers is really a key to their the way they work.
Okay. The location of
HPV associated cancers. Now, do you remember where they infect?
Well, we have cervix, throat, anus.
Yes, but more importantly, what part?
Oh my gosh.
The basal, undifferentiated stem cell basal area.
All right.
That area typically has a high amount of what we call tumor infiltrating lymphocytes, TILs. They're called lymphocytes. They're CD8 positive. If you recall back, we've discussed this a few times where we have the tumor infiltrating lymphocytes that attack the tumor and get into the tumor and attack it, but are disabled by PD-1. And then we have the CD4 positive immune cells, which are called the Tregs. And those are T cells that go in and actually supply the cancers with food and growth factors and different things. So Tregs bad, TILs good.
Okay.
So the area that HPV infects, because once again, it only affects certain cells, the basal cells, typically has a high amount of these TILs. So it's kind of a worst case scenario. It's not a smart evolutionary process of the HPV, and it may change its evolution. Yeah, lucky for us. It may change its evolution, and this is probably why it hasn't killed us yet, because it will if it has a chance. So the location of HPV positive head and neck cancers is typically the base of the tongue and the tonsils, and this is an area that contains a lot of lymphoid tissue.
Okay.
And so this is the area that has these CD8 positive immune cells. Lymphoid tissue is high in immune cells.
Okay.
So because of that, that opens up a particularly favorable response to standard treatment.
Okay.
And also opens up the door for immunotherapy.
Okay. So that's kind of the silver lining.
It's the Achilles heel of HPV infected cancers.
Right.
And so they typically do better.
Right. Because it makes your immune system pay more attention.
It's primed already, ready to go.
Got it.
It's in an area that has immune cells.
Okay. If you've had the vaccine already, does this make it even easier for the immune system?
Yeah, because it's going to have the antibodies right there.
Okay. Got it.
Now, that's kind of a redundant or a mute point, because if you have a strain of HPV that is causing you cancer, you obviously haven't been vaccinated against it.
Against that one, yes. Okay, that what I was wondering is, does having, even kind of close to the mark, like being
Off-label, we call that.
Okay. But no, it doesn't really help.
It can.
It can.
Yeah.
Oh my gosh.
Yes,
Okay.
it can. And that is something that's really hard to quantify and qualify.
Okay. Just because we don't know enough
yes,
yet?
we know that. We do know. I mean, these strains are all very similar. So whether there's something in that antibody that we've created that is going to affect us against numerous strains, it can happen. Yeah,
Okay.
definitely.
All right.
Yes.
But again, back to
It's like flu shots.
get the vaccine.
You have some off-label protection. You may not, if you get the flu shot and the wrong strain comes, they predicted the wrong strain, for example, you may still have some protection against that, and you'll have a reduced course of infection.
Right.
So it's the same with HPV.
Okay.
It's similar to most other viruses.
Okay, that makes sense.
So treatment.
Yes.
So the standard, what we do know about it is it's very susceptible to radiation therapy.
Okay.
Now, there's been a bunch of studies that go back and forth on this, but from our data, where it stands today, radiation therapy is something that you would do typically in HPV-infected head and neck cancers, not so much in non-HPV or HPV-negative cancers, because radiation in the throat and the neck area is a really bad thing.
Okay.
Causes a lot of problems. You need feeding tubes, swallowing, all kinds of issues there.
But if you have proof that HPV is involved in your cancer,
you can get a lower dose of radiation, palliative dose maybe, for example, and get
have better benefits.
And if you have an ATM mutation, it's even more beneficial.
Yes, that's right.
So the standard treatment is typically a platinum drug, chemotherapy drug called cisplatin, and radiation and surgery, of course.
Okay.
Now, in that regard, there's also something called proton therapy. And proton therapy is, it doesn't use ionizing radiation. It uses actual a beam of protons. And the benefits of that is with proton therapy, and there are a few proton therapy machines around. There's a few centers around now. The benefit of proton therapy is it has something, it increases the energy, it creates this energy peak it's called the Bragg peak. And this Bragg peak is an area of intense energy that typically occurs in the back or the posterior part of the tumor. And that's why proton therapy is good, is because it creates this Bragg peak in the back of the tumor, right, as it's leaving the tumor, not necessarily as it's going in, but as it's leaving the tumor. So that is an important thing. So the studies have shown that proton therapy in head and neck cancers
with HPV.
Regardless.
Okay,
regardless. But it typically, yes, with HPV. Gives you the same benefits as radiation therapy, but much less side effects.
Ooh.
So, people need less feeding tubes and weight loss and so on. And so proton therapy is the way to go for head and neck cancers versus radiation therapy.
Okay, regardless of HPV status.
Yes.
Okay.
Or it may not be as beneficial without HPV positivity.
Got it. Okay.
So there was some studies a few years ago that looked at a drug, an EGFR inhibitor called cetuximab. And they included that cisplatin, radiation, and cetuximab. It's a monoclonal antibody against the EGFR inhibitor, epidermal growth factor receptor. And this is a common treatment in lung cancers. It's one of the first targeted therapies, or it's like the second targeted therapy ever that we came up with. It's great drugs for many, many reasons. The doctors and scientists first rationalized that since this HPV infection occurs mostly in this area of the basal area, that cetuximab and other anti-EGF therapies may be beneficial. So they did a lot of studies on that. Unfortunately, it didn't pan out, and it's actually worse if you have strains 16 or 18. So if you have either strain or 16 or 18, we don't know about the other strains yet. We just have data for 16 and 18. Don't use cetuximab. It actually reduces the ability of the cisplatin radiation therapy.
Okay.
So it's not a good thing
Okay.
in that case. And that's probably because EGFR typically is expressed in the cells, the epidermis cells, which are above the basal cells.
Okay.
So that might be part of the mechanism. I'm not sure. I'm postulating there.
Okay. But this again comes back to why we need to know the types, the genetics that we really need to know
Totally.
what strain or
Exactly.
yeah.
Exactly.
Okay.
So the main thing that we look at when we see HPV is immunotherapy.
Mm-hmm.
And the reason is because so the studies have looked at basically P16 variants, or sorry, so the HPV 16 variant.
Okay.
That's what they did. So what they did was they got a bunch of people with head and neck. It was a checkmate study. They had a bunch of people with head and neck cancers that were HPV positive they looked at the 16, and they gave the patients that were positive for HPV and negative for HPV the immunotherapy. And the immunotherapy actually worked for both subtypes, but it worked much better for the HPV positive. So definitely PD-1 inhibitors are really beneficial for HPV positive head and neck cancers, and I would assume most. Now, the reason for that is, once again, how HPV cancers occur. So they produce this high amount of viral antigens, so the immune system is primed and ready. And once again, they typically occupy areas that have high amounts of TILs, tumor-infiltrating lymphocytes, the CD8 positive cells. And they disable these cells by overexpressing PD-1 ligand. And so when you take a immunotherapy, a PD-1 inhibitor, you're reactivating these T lymphocytes, these TILs, tumor-infiltrating lymphocytes, right in the area where the HPV occurs. And so, it's a perfect thing, perfect vehicle for this.
So you get, again, more immune system activity and attention.
Right off the bat.
Right where you need it.
Exactly, yes.
Okay.
And then they produce a high antigen load. So they cause a lot of different random mutations, not necessarily in genes, but just throughout the DNA. And that really allows the immune system to recognize it and show that it's very different from, the other cells in our body.
Right, which lets it target it better.
Yeah.
Okay.
So immunotherapy, definitely the way to go.
Okay, with HPV-based cancers.
HPV-based cancers, yeah.
Okay. Excellent. Now, so let's say I get diagnosed with cervical cancer. Am I automatically going to be tested to see if I have HPV and if that's involved, or is that something that I have to ask?
You may look at one or two strains. Some doctors do, some doctors don't. They're probably not going to treat you any differently regardless.
Okay, but as you're saying, there are some major differences in how well your treatment's going to work. Yeah. If there is
just a lack of
HPV
incorporation
strain
of precision oncology in this area. I mean, precision oncology incorporates the latest information and applies it directly to each individual patient. So across the board, this information may only be beneficial to select groups of patients. So that's why the doctors are not being supplied with this information now.
Or they might not do it for everybody.
It's not what they call ready for prime time. It only affects certain patients. It's only going to be relevant to certain patients.
Right. But this would be something that you and your team would naturally look for if you were doing,
we always do,
the deep dive into someone's medical history, or if you were recommending certain tests for them for diagnostics.
Exactly.
Okay, so it's definitely something to consider. Given what you were saying about, how prevalent it is in certain types of cancer, 70–80%.
Oh, hugely. We could wipe out so many cancers if we had mass HPV vaccinations.
All right. So, and it's never too late, because we don't know whether we
don't know what strains we've been infected with. We've definitely been infected with strains. We just don't know which ones.
Right.
And we don't know when we're going to be reinfected with different strains. And we don't know, all of the strains that have oncogenic activity.
Right.
So get a shot anytime, anywhere.
Right. Do not hesitate.
Don't hesitate.
Yeah. Okay.
And don't take no.
Right. Yes, you can take matters into your own hands when it comes
Definitely.
to this. Again, because pharmacists are permitted to get you the vaccine regardless of whether you have authorization from your GP. It's just a matter of whether you would have then any sort of insurance coverage or healthcare coverage for the vaccinations.
Yeah, and who the pharmacist is and how knowledgeable they are on that.
This is true. Yes. So
I was lucky when I went to get my shot way back when they first came out, and I probably need an upgrade. I believe this was in 2007. So it was really the beginning of the HPV vaccine, maybe 2006. I went to the university doctor at the time at the University Medical Center, and he happened to be a molecular biologist with a degree in virology. And he explained it to us right then and there why he thought everyone should get HPV vaccines. He didn't have all the information we discussed today, but he was able to say, yes, everyone should get it.
He could see the writing on the wall.
He could see it, yes. Yes.
Yeah, and that does make a difference.
It does,
Having someone supporting your healthcare who
And he got it covered for us too.
This is even better.
Yes, exactly.
Yes. So don't take no for an answer. That's kind of the ultimate answer from you today.
Yeah.
Make sure you get that vaccine.
Yes.
And if you do develop cancer, make sure that you get the genetic testing to find out whether HPV is involved, because it often is.
Genetic testing. Genetic testing to differentiate the genetic testing for HPV. Which is not necessarily called genetic testing.
Oh, what is it called?
It's just called HPV testing.
HPV testing.
I wouldn't call it genetic testing, although the newer tests do look at viral DNA.
Right. Okay.
Yeah.
So HPV tests.
HPV tests, yes.
Okay. But as you say, maybe don't even bother getting the test, because chances are you have some strain and you want to protect yourself moving forward.
Well, if you have cancer,
if you have cancer,
definitely you want to know which strain you have,
right?
Because each strain is going to function differently.
Right. So if you don't yet have cancer and you go get the vaccine is the point. And if you do have cancer, then having a test to see which HPV strain, if any, are involved. Strains.
Don't just go for one.
Right. Because they can have, as you're saying about that clinical trial or that study, it can have a profound effect on how well it's
and the new theory now is that it's not just a single strain that causes a cancer. It's how many different strains you have is going to dictate that. So even if you do have HPV associated cancer, get the shot, because you don't want to get reinfected with additional strains. You're susceptible to infection with additional strains, and you don't want to get infected with additional strains that could potentiate and make that cancer more aggressive.
That's right. Yes. It's kind of like with cancer, as I'm coming to understand it, it's kind of like there's really one cause. It's more like the straw that breaks the camel's back.
Exactly.
There's
a
series of things that happen.
And
if you through diet, exercise, good self-care, vaccinations, all those things can help to take some of those straws off.
No, I mean, this opens up the door. People always say, "Oh, I don't need a vaccination," or I've got a good immune system. It's not to do with that. Every time you get infected by a virus, regardless of the virus, it alters your DNA. You don't know where that flu virus is going to integrate its DNA. It could knock out one of your tumor suppressor genes. It could create an oncogene. You don't want to get infected with viruses. They are deadly.
If you can prevent it, right?
All viruses, flu, anything. I get every vaccine I can. It's just free immunity, free protection against these little buggers.
You're the one who
they're going to take us out.
Yeah. Well, they're certainly trying.
Well, they're the cause of evolution. So, we can't get rid of them.
The viruses
we can't get rid of them. They're important.
Right. But we can, when we know that one could be potentially dangerous, we can get the vaccine and protect ourselves from that, at least. Yeah. Doing our best.
Exactly,
Yeah.
yes.
Yeah. Because prevention is so important. And yes, that's right. Because when you have cancer, you're going through cancer treatment, your immune system's naturally struggling. So if you have these other viruses that you could prevent with vaccinations.
They may be just sitting in your system ready to infect a cell.
Yeah, because a large number of cancer patients ultimately end up dying from things like pneumonia and other things that we have a vaccine for these things.
We've got some great vaccines. Yes.
Maybe we'll do a whole show on other types of vaccines that are good to get too, because it's such an important thing.
Pneumonia vaccine.
Yeah.
Everyone should get that too. It's like the HPV. I mean, it protects you against the strains that we don't have treatments for.
Mm-hmm. Yeah.
You
So if
know,
you can prevent those, that would be
the
great.
drug-resistant strains.
Mhm.
Well, you know, you get those. That's it.
Mhm.
There's nothing to treat you
Especially
with.
if you have that compromised immune system
Definitely,
already.
yes. Yes.
Mhm. Yeah.
Thank you for watching Ketome TV. Subscribe below and stay informed.